After a hard spring with a lot of people dying from COVID-19, and with Sweden actually having the highest death rate in the world for a couple of weeks, the pandemic slowed down, and we've had a more relaxed period during the summer. But as you can see in this slide, the number of cases are now increasing. They did so in Central Europe to start with, and now it's also increasing in our area of the world. The government had a press conference last Thursday, and no new measures were invoked. And the question is, what do we do? And the thing is now that we have, through a coup, taken over the Public Health Agency and have the possibility to build a strategy on our own for Sweden. And to do so, I have gathered my colleagues, Vahlne, Nele, Brusselaers, and Lötvall, to discuss what measures should we prioritize in order for the pandemic to slow down further. We will start off by an introductory round, so please say a few words about yourself, starting with Vahlne.
I'm a retired professor of clinical virology from the Karolinska Institute and a senior consultant at the clinical laboratory of virology at the Karolinska Hospital. I'm now retired, but I'm still active as the director of the Global Virus Network and also of the President's Advisory Board of the University College Dublin in things regarding the National Virus Reference Laboratory in Ireland.
Thank you, Nele.
I'm an associate professor in clinical epidemiology at Karolinska Institute, and from next week onwards also at the University of Antwerp. I'm a medical doctor. I'm also trained in infection control and hospital hygiene, and I've been working around mainly hospital-acquired infections and microbiome last couple of years as well. So,
yes, Jan.
Hi, I'm Jan Lötvall. I'm professor of allergy, clinical senior consultant as well at the University of Gothenburg in Sweden. I've been working in the field of asthma research for many years, including translational asthma research, as well as epidemiology of asthma. But last 15 years or so, I've been working a lot on nanobiology, something called exosomes. And that field of research, we even have a SARS-CoV-2 vaccine candidate in our laboratory that we're working with.
Thank you. And my name is Stefan Einhorn. I'm a professor of molecular oncology and an oncologist at the Karolinska Institute and University Hospital. I am also the author of several books and the chairman of the Center for Social Sustainability at the Karolinska Institute. Now, have you all understood our task? We have taken over the Public Health Agency. We can now rule Sweden with regard to the pandemic. The government, they are obeying our instructions. And what measures do we take as the number of cases increase? And how do we prioritize these measures? And we cannot leave this Sunday sofa before we have reached a consensus. Even if it takes a week, we will be stuck here together. And that is our task for the moment. So let's start by saying what possible measures do we have? What tools do we have in our toolbox that we can use to mitigate and suppress the pandemic? Who wants to start
Yeah, I would actually start with trying to break the chain. So limit transmission of the infection. We have quite a few things which in our toolbox which could be implemented quite easily, and we should have the capacity to do it. One of them is mouth masks. We even know, okay, surgical ones, those used in the hospital are the best ones, but even cotton masks can help. So in principle, they can be easy implemented. So I would recommend them to be used basically everywhere where social distancing is not possible, especially indoors, like public transport, crowded areas. Another thing I would certainly prioritize is test and trace. So and isolate. So if you have, if there is a positive case, even if it's an asymptomatic one, trace the context, test them, and before they're tested, put them in isolation until a certain period is over. If it's 7 days, 14 days, that needs to be discussed. But then, and also preferably test them, and then those two things are already a big way to limit. And then I would also still limit crowds. So you don't have big groups together, not for concerts, not in bars, not in discotheques. You can still have. I really want life to become normal again. So I would certainly not put everything in a lockdown now, but just try to find measurements that make life possible and kind of as close as normal as possible. But I want to get rid of this pandemic.
Thank you.
As soon as possible.
Thank you, Nele. Who goes next?
I can go next. So I agree with Nele that we really have to break the chain of infection somehow. And testing, tracing, and isolating is absolutely crucial in that process. I also think we should try to identify where there are infected individuals. For example, I mean, we still don't know exactly how the infection is spread in schools, but we know it can be spread in schools. And if it is, we should test the children, test the classes, and if there's a class with infection, every family should be informed, and that class should probably be isolated with the parents for 2 weeks, exactly.
Yeah.
So that's one other measure. It's about breaking the chain, as you say, and putting barriers between those that are infected and those that are not. And taking away children from school that are infected is kind of natural.
Well, we seem all to be in agreement here. I agree with what Nele and John said. And then there are a few possibilities. We now know that what probably is very, very important is how sick you become when you're infected. Is depending upon what we call the type of unspecific immunity that we are born with. It's called innate immunity. When you get infected with the virus, you start produce type of proteins that we call interferons, and because they interfere with the virus replication, virus increase in the body, and it's so we get most oftenly we get rid of the virus infection before we get antibodies or specific T cell immunity, the T cells that have been talked about a lot lately. So, and the virus, the coronavirus, and like SARS-CoV-2, which is now causing the COVID pandemic, is extremely sensitive to the innate immunity and to interferons, and it has equipped itself with tools to avoid initiating or activate the innate immunity in the host it infects. So if we can activate the innate immunity before we get infected, we seem to cope with the virus infection much better, and particularly the coronavirus infections. And you can do that by vaccinating with live virus vaccines. Very simple ones like measles, rubella, and mumps vaccine. It was called MMR, or in Sweden, the triple vaccine. And then that will boost the innate immunity for months and maybe years. And I can come back later why it's so important and why it's so long lasting, the effect, because very, very recent scientific discoveries really talk in that direction. But I'll stop there, and I wish to come back.
Yes.
Yeah, I'm sure you all want to come back, and we're not taking the easy approach in this case. It's good that you mentioned test and trace and face masks, but we need to prioritize what is our top priority. When do we need face masks, and how do we do the testing and the tracing? And we also have another number of questions. Should we close the schools? Should we close the restaurants, the bars, the shop? Should we change the method for contact tracing? In Sweden now, it is up to the patient, him or herself, often to do the contact tracing. And we don't have endless resources. We can't run tests on everyone. How should we prioritize? And what about the elderly? Should they be allowed to have visits now, or was this a premature decision? So please, the floor is yours.
There are so many questions that you
Yes.
post there, so if we could take one at a time. I think testing is firstly for those that have any respiratory symptoms, and that's what's happening now. But I think there's also a possibility of testing tight groups, for example, school classes or people that work closely together. And I don't know if much bulk testing has been performed yet in Sweden, that you have one test for a group of individuals. But I think that's an opportunity to test also non-symptomatic. So you have a test with 10 individuals, and you get a positive answer in that one. You know that at least one is infected, and then you go in and do the individual testing after that. So has that been implemented at all in Sweden? Does anybody know?
I know they talked about it. In our lab, but I don't think they started doing it.
I think that's clearly a cheaper way of testing non-symptomatic individuals, and you can have a pretty clear path to action and tracing and isolating.
And it's also a way to reduce the quarantine, because if you know that nobody is positive of a group, then you don't have to stay in isolation for 2 weeks.
Exactly.
Also, they're developing and has been developed new tests that are simpler and quicker and cheap. And the only problem that people have seen is that they are less sensitive. Now, I think for practical reasons, that's not a problem, because probably of those infected with this virus, only 20% are in practical terms transmitting the virus to others. And those are the ones which have the highest numbers of virus in their upper respiratory tract. So if you detect them, and then you've done a lot. And they don't need all the instruments, the more very, very expensive instruments that we're now using for what we call the real-time PCR. So I think we should implement them.
Okay, so new tests that are less sensitive, but that's a priority. And what about this collective testing? I excuse a naive question. Does everyone spit in a bucket and you analyze the bucket, or what? How do you do it?
You should certainly not use the same devices.
Well, no, exactly. I don't know if it's been implemented or there's a routine tested or established for COVID swabs, group swabs, but at least in theory, that should be a possibility. I know when the test for HIV started very early, they were very expensive, and they did bulk testing, and then they did individual testing and found any positive in those samples. So,
well, I still think they just put the samples together in the lab, because the expensive part is the processing of the samples. Okay, the test tubes also cost something, but it's the processing. So then they just put all the spit or part of the spit together.
Okay, so let's see here. Can we take away some measures from the list? Can I ask you, should we close the schools if this pandemic will increase to a large extent? What do you think?
I don't think we should close the schools, but like Jan suggested, that if someone gets infected in a class, we could close that class and or isolate the class, and they have to be schooled at home for 2 weeks. Until 2 weeks.
Yeah.
So that's a less drastic implementation.
Well, I would also prefer to keep the schools open because, everyone wants to have a normal life, and many people have made drastic changes in their life, also in Sweden since the beginning. Many small kids, I think, have stayed at home. But then I would, for sure, if you keep it open, besides monitoring or keeping track of who's infected and isolating, I would also try to do more to make sure it doesn't spread, to make some sort of bubbles that not all the kids just run around in busy eating rooms, having lunch all together with 400 kids or something. More ventilation, so measurements that it doesn't spread as fast and as far in the schools. But certainly also protecting, especially thinking about the grown-ups, the adults, and then you could, for example, wear mouth masks if adults meet each other, or when parents drop off the kids and pick them up, you could easily wear a mouth mask just for 10 minutes.
Jan?
I think there are a lot of measures to keep the schools open, as Nele and Anders said, and one is to be very diligent when there is an infection. You could also reduce the size of the classes. You could ventilate, as Nele mentioned, that is open windows and have fresh air coming through. We know that reduces the risk of infection. But each school should think about how to deal with the COVID or reduce the risk of spread of COVID-19 in the schools. We know that there are teachers that have been infected and even passed away. So every school needs to take it seriously and think about it and make a plan. And the resources and the situation may be different in every school, and possibly they should have their own plan.
What about preschools? These kids, they are constantly infected, more or less. What do we do with them?
Well, I think that in this sense, it's good that they are constantly infected. Maybe that's one of the reasons they don't get so sick when they're infected with the SARS virus, the SARS-CoV-2 virus, because they have a constant turn on of their innate immunity, the unspecific immunity.
Okay, so we should let them run around with their infections and be happy about it.
Well, if they are coughing, if it's symptoms, likely to be COVID, and if they have been in contact with a suspected COVID thing, then I wouldn't be too happy to let them run around, especially not if it's close family members that they've been sure who are clearly sick from this virus. I would certainly not send them to school. Then it's better to keep them home, even if they're asymptomatic or just the usual running noses.
I mean, you can test even small kids and trace, and even children can have face masks. That's for sure.
Yeah, and why couldn't you do bulk testing if that's a possibility of children as well?
Yeah.
So that's a possibility. There are definitely cases of preschool children that have spread COVID in families. We should not neglect that possibility and be diligent also about the possibility of spread happening in preschool.
No, I think it's important to say that children do get infected.
Yes.
And the children
Can get sick.
do produce a lot of virus, can produce a lot
more
in their respiratory tract. So they can be infectious.
Yeah. But in Belgium, the system is now that all kids above 12 need to wear a mask at school, so also in university. So if you, but the smaller kids don't have to. But the funny thing that you see is that also 10 and 11-year-olds want to wear them. So to be big.
That was someone.
She has a son in the background who's not wearing a mask.
He likes wearing it, actually. So if he sees a big sign of a mouth mask, he's like, I can't go in without.
How old is he?
He wasn't wearing. He couldn't put on his dragon suit again, so now he's fixed. So he's back watching his dragon suit. So he's also when he sees the big signs on the walls in Belgium, like you have to wear a mask. He's also, Mommy, I can't go in without my mask, and he wears it because then he's a superhero. So he also doesn't have a problem. Okay, I can't demand of him to keep wearing it the whole day, but he doesn't object to wear it in a shop or when it's crowded. Then he actually wants it himself because then everyone is wearing it. And I know there is a lot of people are worried in Belgium that wearing the mouth mask in children creates some sort of an anxiety because they are constantly aware. But if we can break this pandemic and slow it down, then we get rid of the pandemic, then you don't have to be anxious anymore. And a mouth mask is something that can reduce anxiety because it also offers you personally protection and keeps you from spreading it to your family members, I think.
Very good.
The one thing with preschool children is that they can't socially distance. They want to hug you and kiss you and speak with you and yell in your face and things like this. So it's just impossible. We have to check these kids as well.
Yes, very good. Turning to face masks, we need to break it up into smaller quantities. When are the face masks most important? In healthcare, in retirement homes, in schools, in transportation, in closed areas? Where is the top priority for using face masks?
Well, for me, there should not be any discussion that mouth masks are implemented in hospitals when you see patients, whatever ward you are. And especially if you, as a healthcare worker, want to wear a mask, I would not even question the wearing of a mask. Because there are always people being sick. We know that they work, otherwise surgeons would not be wearing them in an operating theater. I would not, please wear a mask at the VAR Central or anywhere. I would recommend them everywhere where you have close contact with people that you don't know and indoors.
But we can't make it so easy for ourselves to always recommend. We have to prioritize. What do you guys think is the top priority with face masks?
Well, it's definitely indoors in crowded places, as Nele says. And I totally agree that hospital is one of the most risky environments to spread the virus, and healthcare workers do sometimes drive an epidemic. So I think that's very important. Elderly homes, staff in elderly homes should definitely wear it. And they do in some places, I know that. So that's other matter.
Visitors to elderly homes as well.
But Stefan, I don't totally agree with you, because face mask is among the cheapest things we can do to slow down this spread and create a barrier between the respiratory tracts of people. So, it's not all the time, of course not. But if you're outside, you're fine. But every time you're inside with other people, why not?
Oh, yeah, and absolutely. I think it's very cheerful if you have your own homemade masks, or you have all those fashion ones. You can even buy them from René Magritte and other artists, that you have your own personalized one. And then I think it's cheerful. So it just has to be something normal, and you easily get your routines of wearing them. So you can wash them. It doesn't have to cost anything. You buy a few, you make a few, and reuse them.
Okay. Thank you for your input, but I'm running the show, and I want us to
Yes,
prioritize.
boss.
There are limited resources. I don't think we can have, if they would implement face masks today, it would still be scarce, and we have to make a priority. Anders, what do you think is the top priority for face masks?
Well, I agree with you about hospitals, and but then again, you know, I would like to object what you just said, that because I think we shouldn't be in English called fummites, and that's when you touch a doorknob or something like that, you leave the virus, and then someone else comes and touch the same doorknob and then put their fingers in the face and get infected. I think that today people don't think that that's a major way of how the virus is spread. And if you take face masks, even the simple ones, you buy in the pharmacies, look like paper, but they are three layers anyway. And you can reuse them. I mean, if you're not infected yourself, very limited amount of virus will actually come to that. I mean, you don't throw away your clothes when you're being around, you know, in public and close contacts with other people. And the same thing I would say would go for these cheap face masks. When they do get a lot of viruses when you're self-infected, but then again, you don't infect yourself, already infected. So I would say I'm reusing my cheap mask as well.
Yeah.
Okay, very good. Let's turn to the question of restaurants, bars, and shops. Should we close them?
No.
That's one of the most difficult questions, I think. We know that in some countries, the bars and pubs and late night drinking is one of the biggest risk factors of spreading the virus. And when you drink and you're outside and you're with friends, you're probably louder. We know that screaming or singing and things like that actually increase the spread of the virus-filled aerosols. So I think it's a tough one. I would certainly not go to a restaurant right now, especially not a crowded one, maybe outdoor one. But I would, if we get a starting of a proper curve that is pointing upwards, closing restaurants is probably one of the first things I would suggest.
I also didn't go to any restaurants between March and August when I was in Sweden. I went now twice in Belgium, and I actually felt safe because when you enter, there's a list, you can write your name down. So if you know that anyone in the restaurant has tested positive, you will be notified. It wasn't even, I think, 1/3 of the normal occupancy. You needed to wear a mask when you go to your table, when you're eating, of course. When you're with your little group of people, you don't have to wear it. If you go to the toilet, you wear your mask again. The waiters are wearing it. And also at the entrance, like in all the shops, there is hand alcohol, so you wash your hands. So I actually felt at ease. I would not feel at ease to go to a restaurant in Sweden. And
So if you look at the UK, right, the one of the core culture things there is go to the pub. And opening of the pub was actually something that has really increased the spread of the virus in that country. And you know, if you can have strict ways of controlling the restaurants and controlling the crowdiness of the restaurant, maybe it's possible to keep some open. But the measures that have been done so far in Sweden have not kept the spread in restaurants down at all.
No. And there are reports as well, I think it was from the US, of bars that they really did their best to limit the spread. But if it's a big place where they have like 100 people at the same time, even if it's big and it starts spreading, then you still have a lot of infections, even if you try it. So you will never, if you keep them open, you will never be able to break a chain completely. So you will always have a risk that it spreads.
Well, I would definitely close pubs as long as they're indoors and you're crowded. But restaurants, if you limit it depends on the restaurant. I mean, if it's a high ceiling and the tables are far away from one another,
good ventilation,
and good ventilation, that's one thing. But I mean, small, cozy restaurants with lots of people.
What
But
about shops?
Sorry,
Shops, should they remain open?
it depends on the shop, I would say. In the groceries, I mean, normally it's the very high ceilings, not all that much people, and maybe you can limit the number of people that can be in the grocery at one time. But if you take a smaller shop, I mean, first of all, I would make it mandatory for all the people working in the shops to wear face masks.
And you can also just,
not for the people entering into the shop.
Let them stand in a line with 1.5 meters distance, and then just enter them one by one. And then instead of that they would be in a line in the shop, they're now in a line on the street. So you have less people at the same time. And if they then wear mouth masks, there shouldn't be any problem of transmission, because a mouth mask will keep everyone safe. Plus the door is open because everyone is going in and out.
That's how shops in the United States have done, right? They require masks because they don't want to be responsible for any spread in their shop. So they require masks on everybody, including the staff member. And they limit the number of people in the shop according to whichever local regulations they have. And as you say that, queuing outside is much better than queuing inside and being crowded in front of the cashier.
One thing they ask in Belgium as well is that they use trolleys, and because then you have the trolley in front of you, so you always have some sort of a distance as well. And in some shops they also made the IKEA thing, how that you have to follow the same path. So even in smaller shops you can't just walk around. So they really ask you to not linger around in the shop, only stay there for the time you need. I know in Belgium they also had a time, I think, for the clothing shops that they limited that you could only go shopping alone, but that was really bad for the economy because people don't want to go shopping without their friends or without their mother or something. So they removed that, but then they still limit the number of people in a shop at the same time.
Okay, the thing happened in Sweden, actually in Båstad, a small town on the Swedish west coast. The off-license, Systembolaget, really limited the number of people, and you had to queue outside if you wanted to get in, if there were too many people inside.
Okay, but I believe that closing shops is not the top priority at this stage. What about visiting the elderly? That is allowed from the 1st of October. Do you think that should be changed as the number of cases are increasing?
I would keep a list of who visits. So if someone is positive, that you can track them down. I would recommend mouth masks for people visiting them, because then they can still visit them. And but then that the risk of the visitors infecting the elderly is lower. Because it's also tough for the elderly to stay in isolation, because they maybe even a normal life don't get that much visit. So it's important that they are seeing people, but then I would try to control it, that it's also no big parties in the elderly homes, and especially not people with any symptoms of colds, that they should certainly not go in, for sure.
Okay.
Of course you should definitely not even allow visits of anybody who is infected. My belief was that most of the infections in elderly homes came from staff to the elderly and not from visitors to the elderly. So from my perspective, it's been a little bit not very logical to not allow any visitors to the elderly homes, whereas the staff can change on a daily basis almost. So, but implementing masks both on visitors and on staff members in the elderly home, I think is a very high priority. I read today there was an increase in the number of cases in elderly homes in Stockholm already. So that's something that we should be very much aware of right now.
Okay, so we don't we allow visits to the elderly. That is not an issue.
But in a limited way and in a controlled way.
Absolutely. Do we close the borders if the number of cases increasing? Is that a top priority?
No, I mean, if the number of cases in Sweden are increasing, we should, of course, implement strict and careful transfer of people between countries. But that's from Sweden to other countries. We should have safe travels. And there, I think number one priority is face masks and implementing them both in the airport and transfers and the planes, of course.
I would still discourage, no official recommendation, but I would still discourage traveling abroad for holiday purposes. Many people do work abroad or have family abroad and need to travel. So that's, of course, more essential travel. But yeah, I think that's one of the things that didn't go optimal in Europe is that everyone, spring was over, the numbers were a bit more acceptable, and then the planes started flying again, and everyone just went to Ibiza and Croatia, and not everyone went partying, but many people did, and then it started spreading all over Europe again. So I would still be very careful with international travel for leisure, for
I think we should debate this because the stop of travel in the spring of 2020 didn't really stop the pandemic at all. Viruses feel no borders. If they enter into a country, they spread in that country. So I don't see that unsafe travel has really been an issue, but did closing the borders really limit the spread of the pandemic?
I think that, if you come from a country with high endemic that is having many, many cases, the risk of you being infected increases, of course. And take, for instance, Iceland, where they now had an outbreak because two French tourists broke the quarantine that which was imposed on them. And so you shouldn't close the borders, but if you come from a high endemic area, you should be quarantined. And
so if you travel from Sweden, which is under what you're saying, Stefan, a highly endemic situation, you should not go abroad and go to restaurants and pubs and socialize. You should be quarantined and for at least 2 weeks or maybe shorter, but.
And we did see that when the borders with Sweden went open from the other side, from Norway, from Denmark, that the numbers were rising there because all the Swedes, or many Swedes, brought it to those countries. And it was under economic pressure that the borders opened. But then, wasn't it like 3/4 of the infections in Norway at a certain point, or was it in Denmark related to Swedes or people visiting Sweden? So it for sure helped to protect the.
I mean, one of the biggest unfortunate decisions, I think, was to not put visitors to Italy and Austria in quarantine in February, March, when they came back from those countries after having skied, right? So that really allowed the virus to get a hold of our country and get settled in here. So otherwise, we might have been in a different situation today. So travel is an issue, but closing borders, I'm not sure that's the right way of doing it.
I hear what you're saying, and I see that you don't regard it as a top priority. I'm going to ask you some more issues if they are top priority, and I assume you will give me short answers. Improve the test possibilities. Should we put our limited resources in improving the possibilities to test and get the results quickly? Is that a top priority?
Yes.
Yes, and we should implement the new less sensitive tests and cheaper tests.
Yeah. And increase.
Test, trace, isolate. The most important measure we have to stop the spread of this virus.
What about the method for contact tracing? Should that be changed?
Yes.
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 How?
You can't expect a person hospitalized to trace his contacts, his or her contacts. There should be a system in place, and many people can help. If in the schools can do it. In the bars, they can keep track of it. Okay, you have to think about GDPR regulations and privacy, of course, but then not use the list for sending coupons to the visitors to please visit us again. But then there are many people or many ways to facilitate this, and it should not be the responsible of a person who's lying in intensive care.
Well, one of the things you miss if you do personal tracing or reporting to your friends that you have the infection is that you don't see if there's a trend. If there's visitors to this Systembolaget on Friday, the 13th of something, they got virus infected. So then you can find the clusters or the situation where the spread actually happened in a much better way. If there's somebody or a group of individuals that centrally trace in a region or a city.
Well, everyone has a smartphone, and I know that there are apps basically not collecting any personal information, but just kind of keeping a track, okay, you've been close to a person for longer than, I think you need that they say 10, 15 minutes or something, and then you get some sort of a warning signal. Those things are there without big risks for privacy. So especially in a country like Sweden where everyone has a smartphone, it should be something that could be considered as well.
Anders, do you agree that we should change the method of contact tracing?
Absolutely. I agree with what they said here. Yes.
Okay, next question. We are allowed to meet up to 50 people. It was a suggestion that we would increase it to 500. That has not been, decision has not been taken by the government. Do you think we should keep the number to 50 or should we change that number?
Certainly not to 500. I thought it was such a joke. In March, all the countries were going down and then Sweden said, you can still have parties of 499 people, while in Germany you couldn't go out with 2 or 3 people. Okay, the situation is different. We know more about the virus now than in March. But allowing groups of 500 people where you don't wear mouth masks or don't have social distancing or good ventilation, I think is not a good idea. But if there are some measurements in place, I think if you have concerts where you can sit apart, where you have ventilation, where everyone wear mouth masks, that's a different situation.
I think it depends a little bit on the situation. So, for example, if you have a football stadium with 20,000 seats, if there are 500 people there, outdoors, separated from each other, I don't think that's an issue. Actually, I don't. If it's crowded, we know that football matches can be super spreading events. That's been proven early in the pandemic. But for outdoors gatherings, maybe the 50 number is not that. For indoor, I'm much more concerned, and I think maybe 50 could be a too high of a number. Again, depending on the room you're meeting in, of course, right?
If you can, it's all about social distancing. So it depends, as Jan said, about what type of if you're outdoor, it's different. If you're indoor, you can be less, and it depends on the size of the room. Friends Arena in Sweden, in Stockholm, which holds 50,000 people. Even if they, close the ceiling, which they can, then it's basically indoor. But still, it's like outdoor. So maybe one of the problems here is, of course, that when you pose a rule like this, you have to. I understand it's difficult to be flexible, but there should be some flexibility in these rules.
Okay, is this a top priority to change the number of people meeting?
I guess there's
Down or up, would you mean? It's definitely not up to 500. I would say it's top priority not to do it.
Okay, fine. So I have here gathered a list of your suggestions for what to do, and I will tell you which are the top priorities as I have understood it. And I want you to take a decision collectively with our limited resources. What is our first priority, our second priority, and our third priority? I am sure you will be able to take such a decision. You're all intelligent people, and you have a choice between face masks, changing the method of contact tracing, improved test possibilities, boosting the innate immunity, as Anders discussed, and limiting the spread in the schools by face masks and smaller classes and ventilation. What is the top priority to stop?
First is face masks in indoor and public places, I think, from my perspective.
Okay, that's Jan's top priority. What do you think, Nele and Anders?
Test, trace, isolate, the big alternative from lockdowns if you have the capacity, which has been clear from the beginning of the outbreak. If you can test, trace, isolate, it's a very good alternative if it's not out of control yet.
But in order to do that, I forgot one thing. That was quarantine for household contacts.
Yes.
Yeah, absolutely.
And in order to do that, we have to take a priority. Do we top prioritize testing, or do we top prioritize tracing, or do we top prioritize quarantine?
Well, it's no point of testing if you don't put any consequences to it. If you test positive, you can just run around. It's no point to do the testing. So
I agree with that. Testing, tracing, and isolating is one thing.
Yeah.
Unfortunately, Stefan, we can't prioritize among them.
Well, I will try to convince you that we have to take a tougher priority decision. What do you think, Anders?
Well, I'll tell you what I do. I wear a face mask whenever indoors, in shops, and I don't use public transportation. So it's basically a few times I enter a shop, I wear a face mask. And I boost my innate immunity by vaccinating myself with these live virus vaccines.
I think that's an interesting thing, but I don't think the evidence is as clear as for face masks, for example. So that's why I definitely prioritize face masks over vaccine.
I wouldn't make it mandatory right now, but
okay.
I think we're getting there. And I still would recommend it. I'm recommended to my friends.
Well, and I know that Stefan and we have limited resources. Face masks don't have to come on the budget of politics or health authorities. People can be made responsible because it doesn't cost that much. Even the poorer people can wear face masks. So it's basically just the effect of recommending it or requiring it. It's not that we have to provide face masks to everyone as a government agency.
I would say that the absolute top priority besides face mask and social distancing would be testing, and then using cheaper and quicker tests and implement them quickly. That would be a top priority for me.
Okay. So what I gather so far is that face masks is the top priority, and Anders has suggested improve the testing possibilities.
Yeah.
Comes in second place.
Yes, with the consequence of doing something when you test positive, meaning isolation of you and your household.
Is that okay with you, Jan?
Yes, I totally agree that testing, tracing, and isolating, or testing and isolating, is a number 2 priority. Very high up on the list. If you look at Korea, for example, that's the 2 things they did, was to put on face masks on people and test, trace, and isolate. And that kept the infection down in South Korea very efficiently.
The Swedish Public Health Agency are sort of, they are advocating testing and tracing,
but they're not doing it.
They're not so hard as we are suggesting, and they are not obligatory quarantines of relatives to that.
They're forced to go to school.
Yes. What is your opinion about that?
That it doesn't make sense. It doesn't make sense that if you have a highly sick individual at home, that you let the family members just participate in society, because it's very likely that they are infected themselves and that they could be spreading disease as well. So for me, it's just a way to just, we're not going to stop it anyway.
So I agree. There's a very high risk of spreading the infection in a family situation or in a household. It depends. The risk is, of course, very different in different types of houses. If you're in a small apartment with a lot of people, it's higher risk than you're in a big building with a few people. I know families that have had cases of COVID-19 and saved their family members by being isolated in a separate room and wearing masks and so on. So it is possible, but the risk is so high, I would definitely keep family members isolated together with the sick ones. But I mean, then there are things you could do in the home to reduce the risk of spread in the home.
So what I hear you saying is that quarantining household contacts might be more important than the contact tracing to find out who they have met.
Yeah, because mostly you do have a very close contact with your family members, and your contacts that you met might not have been as long and intense.
And quarantine also children. I mean, it doesn't make sense that you send your child to school if
you have to drop them off and pick them up. And
Okay, so I have a list here that I put forward to you as a suggestion, for our priorities with regard to the pandemic. And remember, we have taken over the Public Health Agency, and we are the ones deciding just at this moment. And our top priority is face masks. Our second priority is improved test possibilities, perhaps new test kits that are becoming available. Our third priority is quarantine for household contacts,
and other close contacts,
including children. And our fourth priority is improved contact tracing. Would you agree that this is our consensus?
Yes. I mean, there are other things too, but it's a start.
Yeah, every little step that you take to reduce the spread of the virus is an important one. And if they're not costly, if they cost nothing, basically, of course you should try to implement them. But with the limited resources, as Stefan very diligently pointed at, I think those are the 4 most important things to look at, and I agree with them.
And from an organizational perspective, I would also invest in clear and accurate science-based communication, that the public is well informed and not just hush down, everything is under control.
But we are the
yes. So we will do that.
We just do that because that's part of what we do.
No one has suggested we go into a lockdown. Now, of course, lockdown is a very unspecific term. I noted that none of you are suggesting we do a proper lockdown when we close the schools and we close the shops, and we are not perhaps allowed to go further than a few hundred meters from our neighborhood. But none of you was suggesting this.
Not under the current circumstances. If there's a even worse situation than there was in the spring. Maybe it should be off the curve is steeper than it was in the spring.
Then I would also
closing school should be considered. Yeah.
And if the situation goes out of hand, I would also not go for a national lockdown, because if you are in Skellefteå or somewhere in the middle of the forest, you don't lockdown. What does it mean? But it could be something which is useful in the cities. But then if it goes out of hand in Stockholm or in Göteborg, then you can consider it there. But let's just hope that it doesn't get that far.
I mean, we know so much more now than we did in February and March, and we should take advantage of that knowledge.
Yes.
And at that time, I really advocated lockdown.
Yes,
we didn't know.
For Stockholm, for sure.
Yeah.
Also because the things were not set up yet. They didn't. The testing needed to be scaled up. Mouth masks, all those things were not, available in many countries. So they didn't really have a choice if they didn't want to have to, limited healthcare capacity.
We didn't know how to treat the disease properly. We've learned together with many other countries and doctors all over the world how to treat the disease more efficiently. We didn't know what the long-term effects of the disease is. So I definitely think it was the right thing to do would have been to do a lockdown, close the schools, and work from home for anybody that can do that. Wear face masks and so on already in March this year. That month has passed with a number of them after it. So that's maybe too late now, but we shouldn't exclude it as a possibility if it happens, if something.
But it feels now that the whole situation in Sweden, some people were indeed in isolation, like most people of the Vetenskapsforum, since March. And then another part of the population just kept going on. And I don't know, if you implement measurements, it could be more normal for everyone with the mouth mask distancing, because you can't just keep being locked up forever, the elderly, people with chronic diseases. And so I think it has to be a bit balanced.
Okay, so we've reached the priority decision. We've reached a consensus. That means we can end this meeting shortly. But before that, I would like you to look into your crystal balls and tell me and everyone else what is going to happen with the pandemic. What is your prophecy about the turn of events? Who wants to start?
I can start then. Unfortunately, I think that we'll get more and more cases in Sweden. And the negligence to impose measures to stop and mitigate or even stop the spread in Sweden is surprising me. I mean, so the numbers we see a rise in cases already. So unfortunately, I will see that happening. And as regards to vaccines, I think a vaccine will be available early in the springtime. And that will do some help. Unfortunately, I think the vaccines will not be that long-lasting per se. Maybe 6 months or so, and you have to vaccinate yourself, maybe once or twice a year. That's not a big problem. I mean, we do that with influenza. That's my forecast for Sweden.
Yeah, I've also been predicting that the numbers would be going up in Sweden. Why wouldn't they? It's the same virus as in other countries. I personally, as a Belgian, I think it's so frustrating because Sweden basically had all the tools in hand: geographic location, low population density, a population who listens to the authorities, testing capacity. They had so many resources and they had all the tools in hand to, limit this outbreak compared to many other countries, and they didn't. So they could have been like Norway or New Zealand if they wanted. And And then, even with all the knowledge gathered during springtime, during summer, they still didn't implement science. And I already thought vaccines, it sounds good. And when they said, okay, they will be available in autumn, I was already thinking like, that's, from one side, it's very late in the pandemic, but then at the other hand, like, it's very optimistic. But then indeed, if you need to vaccinate every few months again, I still really believe in, standard infection control measures, mouth masks, distancing, break the chain of infection. That's something we need to do together. And because everyone is just so tired of this pandemic.
So my prediction is that we will have a second wave or quite extensive spread in Sweden during the fall of 2020. It will not. My prediction is that it's not going to be as high as in the spring. My prediction is also that our mortality will be lower. It seems that fewer people are dying in all age groups from this disease. I don't understand why yet, but that's a prediction I'm making. I hope. We don't know what the long-term consequences of COVID-19 will be, even though the disease might be slightly milder now than it was in the spring. So that's my prediction for until the end of the year. I think we will continue to have COVID-19 cases for many years to come. It will continue to roam on the planet for probably decades. I don't see why it would disappear, as it is. Millions and millions of people have it or have had it, and it's been adapting to human spread quite efficiently over this year. So I think it will continue. My other prediction is that a vaccine, as Anders said, will come in the spring. Not everybody will get it. Maybe you and I, Anders, will not get it as the first individuals. I was happy to be a volunteer and be an early tested individual. But maybe there's priority. Sorry?
There are apparently 5 billion vaccines already in stock.
Oh, really?
Yeah, that I heard a few months ago. So they're already in stock, but then of course have to wait until the results of the clinical trials come in. But they are already produced, and and that was a few months ago. So maybe they already have more. But indeed, if you see that you have to be revaccinated after a while, 5 billion doesn't get you that far.
And getting it all distributed. And so on is another measure. And as Anders said, we don't know how long the vaccines will induce immunity. And I agree with Anders. The evidence argues that the immunity is not that long lasting. It's not once in a lifetime and then you're done. It's probably going to be multiple times in your lifetime that you need to take the vaccine.
Okay.
Can I add that the second wave, that I'm actually afraid that the second wave will also be a second wave in hospitalizations, and that's not only in detected cases, because that's something we see in Belgium. The second wave or the increase that we've seen the last couple of weeks in Belgium was mainly due to also way broader testing. So while the hospitalizations have not been really going up yet until very, very recently, and it's still under control. So since they still don't do the widespread testing as they do in other countries, that will not be the main thing in Sweden, that it's always because of more testing.
But of course, we all hope that we're wrong and that there is no big second wave. But you asked for the prediction and the crystal ball view, and that's the view.
Yeah, but if I can make a comment, that there is data from this German study suggesting that in all age groups, the mortality is decreased.
That's what I mentioned, yes.
Yeah.
And now it's also mainly younger people getting infected because
but also in the older age group,
yes,
mortality seems to be going down, and that is something although we don't understand the mechanism, we can hope.
I'm not surprised because let's face it, in Sweden we didn't treat the elderly people this spring, and we imposed palliative care to people who could have been treated, and yet we also know now how to treat in a better way and earlier in the infection than we did before. So we don't. So the fatality rate, as Jan said, is going down, and I think there are
multiple reasons for that, and one is,
but not only the virus itself changed. I think it's the most important reasons are that we treat people better.
Better healthcare. One thing we haven't talked about is antivirals. I'm a little bit disappointed that remdesivir didn't work as well as we first thought when the very first testing happened. So what do you think about antivirals for the more severe cases, or anybody that gets this virus? Anders, especially.
One of the problems was really that they were imposed very late in the disease, and we all know that for most virus infections you have to treat early. Same thing was when herpes simplex virus, which was the first antiviral for herpes, it was for cold sores, and when they tested them, you only decreased the number of days you had the cold sore from, say, 7 to 5 days, which wasn't. And everybody knows that if you get a tingling in your lip, which is a symptom before you get the cold sore, and you take the tablets, you don't get any. So you need to be very, very early on when you have the virus, the major part of the virus replication, and the disease is usually, the sickness is usually depending upon your reaction to the virus replication. So
yeah, I mean, another prediction would be that
the majority of virus replication was over, and also for COVID. So if you had given the medicine more freely and early on, then you probably would have had better results.
So another addition to the prediction would be that in the longer perspective, there will be antivirals against SARS-CoV-2 and other coronaviruses, but they need to be safer than, if I understand, remdesivir is not that safe, and they need to be taken as oral medication ideally, not as intravenous, and that will take multiple years before we have that in place.
I'm not sure it will be multiple years.
But it will take time. I mean,
we do have
what's been done right now is really looking for repurposing, known drugs.
Yes, exactly. But we do have promising results with remdesivir. We have promising results with beta interferon and ribavirin. Yep. We have promising results with cortisone, and there are trials going on with combinations of these drugs and also with other drugs. So we shall see. We shall hope. So let me conclude by saying that we are all in agreement with the Public Health Agency that it's important to keep the distance, to stay at home if we have any symptoms, and of course to wash our hands frequently. And then on top of that, we have made a list of priorities that we have managed to reach a consensus about. And by these words, I would like to thank the three contributors to the discussion, as well as our technical wizard, Fredrik Ydhag, who always makes an excellent work. And now let's wave into the camera and say goodbye to our audience. Bye-bye.
Bye-bye.
Bye.